I'm Joanne Byron, and thank you so much for joining us today to discuss this very important topic on how burnout and compassion and fatigue can make an impact on patient safety, employee satisfaction, and quality. I want to introduce our speaker, Dr. Stacy Atkins, but before we do, I just want to run through a little bit of information before we get started. The American Institute of Healthcare Compliance, which is sponsoring today's program, is a licensing and certification partner with CMS. We provide online and live training programs to healthcare professionals in areas of compliance. The information that we're covering today and any discussions that Stacy will have with you as the audience is not to be used as consulting or legal advice. We can only give general advice to people during these types of sessions. So if you do get concerned over any issues generated from today's topic, make sure that you retain a qualified professional to help your organization work through those issues. Today's speaker, Dr. Stacy Atkins, is a compliance specialist and a member of our education department here at the American Institute of Healthcare Compliance. All righty, well, I'm going to go ahead and turn this over to Stacy.
Good afternoon, everyone. Thank you so much for joining me this afternoon for us to discuss this important topic of burnout, compassion fatigue, and moral distress. I'm so excited to see that there's so many people that are interested in learning some practical ways in which they can possibly improve their organization's compliance as it relates to wellness. Today, we're going to be delving into a lot of different things, but we're going to be learning and redefining for some and reaffirming for others the definition of burnout, boundaries, and moral distress. We're going to also go over compliance risk, and we're going to do a couple of case examples. We're going to discuss risk management implications, and we're going to also try to tackle some solutions and strategies for your particular organization. We're also going to hopefully accomplish the following learning objectives. By the end of the webinar, it is my hope that you'll be able to again define burnout, compassion fatigue, and moral distress within healthcare settings, regardless of what your healthcare setting looks like. Hopefully, you'll be able to describe how staff wellness impacts compliance outcomes. You should be able to identify organizational risk factors which are contributing to burnout and boundary erosion in your organization. You should be able to explain the link between retention, engagement, and compliance metrics, and also evaluate strategies to support wellness and reduce compliance risk. And finally, at the conclusion, it is my hope that you'll be able to develop an action plan or action steps to embed wellness into compliance programs within your organization. So before we start, we're going to do a poll. And I want to know what you think is one change that could reduce risk even by 10% in your organization. Please choose the top factor within your organization. What's the biggest burnout risk in your organizational setting? And in a lot of studies, it shows that administrative burden is the top result across many studies as to being the biggest burnout in the United States in healthcare organizations. And we're going to talk about that more as we get into today's presentation. All right, so we're going to take time right now. Some of you may have already come to the presentation with a definition of burnout, compassion fatigue, and moral distress. And for others, this will be the first time that you're getting what's considered a formal definition, and that's completely fine. Burnout is formally recognized by the World Health Organization as an occupational syndrome. It emerges from unmanaged workplace stress and is particularly prevalent in healthcare roles with high emotional labor. Compassion fatigue, while sometimes overlapping with burnout, is more trauma exposure driven. It's the cost of caring deeply over time, especially without adequate support or recovery periods. Moral distress, however, differs. It's rooted in ethical tension. Healthcare workers, especially nurses and social workers, may feel morally compromised when they can't provide what they believe is the right care due to policies, that red tape and the bureaucracy, staffing shortages, or systemic constraints. Unchecked, all three of these conditions can erode engagement and can increase turnover and lead to compliance gaps, making it critical to identify and intervene early. And recognizing early warning signs is really important. Healthcare leaders must be trained to notice subtle behavioral cues that may signal early distress in themselves, but also in their colleagues. Compassion fatigue often begins with reduced empathy, emotional detachment, or avoidance of patients, not out of neglect, but just emotional overload. Now, burnout, however, is a broader and systemic chronic exhaustion. Cynicism and decreased performance are typical. These individuals may appear disengaged or start making more frequent errors. Moral distress is unique in its ethical language. Take time sometimes, and you may have heard this in your colleagues, or you yourself may have even said some of these phrases. Listen out for phrases like, I know what I should be doing. I know what should be done, but I can't. Or that wasn't right, but I had no choice. These phrases often stem from systemic constraints, not individual capability or capacity. Early recognition, asking supportive questions, and interviewing with peer support, ethics consults, or reassignments can help protect staff, patients, and compliance. The National Academy of Medicine and multiple peer reviewed studies affirm that early detection and support reduce errors, improve documentation quality, and support retention. Now, I want to break down what's happening here. We're going to do this case. I call it the case of the fatigue nurse when burnout becomes a compliance risk. So we have here in this case summary Nurse Julia. She's a 12-year veteran nurse. She faces burnout due to staff shortages, increased patient acuity. She makes a near miss medication error while emotionally exhausted and morally distressed. So I want you to look at the reflective prompts that I have here on the slide. Which factors contributed most to the risk? How could this affect retention and the compliance method? All right, again, we're going to break down what's happening with Nurse Julia. For starters, she is emotionally exhausted from staffing shortages and rising patient acuity. I don't know, but if you're working anywhere remotely in healthcare, whether you're a nurse or not, this probably is ringing true to you. She makes a near miss medication error while experiencing burnout, compassion fatigue, and moral distress. Legally, Nurse Julia can't leave her post or her unit until she's relieved. Doing so could risk her license and the patient's safety. So let's unpack the key risk factors. And we're going to talk about all of these as we continue throughout today's webinar. But the key risk factors here in this case study are staff shortages, emotional exhaustion, lack of relief, and moral conflict. All of this leads to compliance risk errors, documentation issues, and potential violations, and it hurts retention as nurses feel unsafe and unsupported. In the real world, NOM reports over 50% of clinicians facing burnout. HHS OIG linked high turnover with increased violations. This is a really big problem in the US healthcare system. What causes burnout in healthcare? All of us are in the healthcare profession. So, what do you think causes burnout in health? And in this poll, I want you to select the top two causes you believe contribute: administrative burden and long work hours and unpredictable schedules as being a common theme here. A lot of studies and a lot of the research that I've been doing in this area also highlights those as being the top contributors to burnout in US healthcare. In your own settings, you identify this, but research shows administrative burden and long work hours consistently rank highest across the national surveys. So, we're going to now delve into the top drivers of burnout in the US. Studies consistently cite, as I just repeated, and as you all showed just in your observation, that administrative burden, especially documentation, as the number one driver of burnout among US healthcare providers. Physicians have reported that spending nearly twice as much time on clerical work as they do with patients, creating an imbalance that fuels disengagement and fatigue. Long work hours are another critical factor. Many clinicians work over 60 hours per week. These extended schedules are linked to higher burnout and greater intent to leave. Cultural issues like poor leadership, misaligned values, and lack of autonomy also play a major role. When clinicians feel unsupported or unable to influence their workflow, burnout rises. And finally, fear of litigation and emotional labor, especially in emergency or palliative settings, compound stress, leading to long term moral distress and compliance risks. I'm going to share some facts with you about burnout among junior doctors in Australia versus the US. So, in Victoria, Australia, junior doctors report crisis level burnout. 98% cited burnout as a reason to leave, and over 50% admit to errors due to fatigue. Unpaid overtime and moral distress are widespread. These figures are among the worst in the nation and are tied to compliance and safety risks. Now, here in the US, while physician burnout is trending down, if you can believe it or not, post COVID, nearly half of clinicians still report symptoms. Specialties like emergency medicine remain disproportionately affected. The AMA confirms a link between burnout and quality lapses, reinforcing wellness as a risk management priority in compliance programs. Did you hear that? The AMA is confirming that there is a link between burnout and quality lapses. Therefore, they're reinforcing wellness as a risk management priority in compliance programs. I'm going to pause here for a minute and I'm going to play a video. It's humorous. It's a clip from Dr. Glaucom Flecken. It's a portrayal of the daily grind of a healthcare professional on the edge of burnout. Although it's funny, can't stress enough that burnout is not funny. However, this video captures real warning signs: cognitive overload, multitasking failure, and emotional detachment. The humor is going to make it safe to reflect without shame. What part hits closest to home for you? And could someone in this state follow compliance protocols accurately?
Let's stay unit. Where's your secret hospital bathroom? Dude, I'm not telling you. That would defeat the purpose of the. Oh my God. Is that Bill? I think it is. Hey, Bill, you doing okay, buddy? Oh. He's not looking too good. Wait a second, what's this? Oh, man. What? What is it? It's Bill's post rounds to-do list. There's like 50 items, and none of them are checked off. Oh, God. Is he sick? I don't know. He didn't do his discharge summaries. He didn't consult PTOT on any of these patients. All right, we got to get him some help. Go find a doctor who's good at diagnosing things. Okay. How about him? Ortho? Come on, man. Okay. How about him? An ophthalmologist without a scribe? That's worse than ortho. Bingo. Family medicine. Can you help? I don't know what's wrong with him. Oh, what? You mean Bill? Hey, he's got burnout. What? Burn? Oh, yeah, I know that look. Yeah, Bill feels helpless and defeated in a system that doesn't value him or his well-being. Wait, are you sure? Yeah, you see his eyes? You see how empty they are? Yeah, that's burnout. Yeah. But why isn't he moving? Oh, yeah, with end-stage burnout, your muscles stop working. Why? Because it takes literally every ounce of energy you have left just to keep breathing. What do we do? Yeah, you gotta hit that button. I'm the CEO. How's he doing? Um, Not good. I got you, Bill. Don't you quit your job on me. Oh, hello. I didn't see you there. I was just reading this book on success. You look a little burned out. I've got just the thing: a warm blanket, a hot cup of tea, and a 10-part workshop on resiliency. Over the next 2 weeks, you'll learn how you and you alone.
How many people can actually identify with what was happening with this clinician? If you work in a hospital setting, or even if you work in a non-clinical setting, sometimes the documentation, sometimes just the lack of feeling valued can help spiral you into burnout. What part of this video may have hit closest to home for you, or what supports or structures could have prevented this scenario from playing out in the workplace? Burnout has a direct impact on staff retention. You heard in the comedic sketch where they said, don't quit your job. But studies show that nearly half of US physicians who leave clinical practice report burnout as a major factor. This contributes to staffing shortages and compliance vulnerabilities. Engagement is not just about morale, it's about a compliance tool. Engaged staff are more likely to follow protocols, document thoroughly, and report safety issues. They also create more psychologically safe environments, which lead to better outcomes and fewer violations. Poor engagement, especially when combined with leadership misalignment, increases turnover risk and erodes trust in compliance systems. Ultimately, retaining and engaging staff isn't just a workforce strategy, it's essential to a well functioning, compliant healthcare organization. And we're going to talk about, ways in which some of your ideas can actually play a role in helping to mitigate this burnout. But before we do that, I want to talk about boundaries, a compliance wellness shield, because sometimes people link boundaries to barriers, and I just want to dispel that myth. Boundaries are not barriers, but buffers that protect staff and patients alike. Boundaries are essential to high quality, compliant healthcare, not as personal preferences or limitations. Research has demonstrated that boundaries act as buffers. Why? Because they preserve clinicians' emotional bandwidth and ethical clarity, and they reduce moral distress and burnout. For example, during COVID-19, studies have shown that healthcare workers who enforce boundaries, such as not checking work messages at home, maintained focus and made fewer errors. The AMA and the Joint Commission now recognize that protected time and clear expectations around availability reduce documentation lapse and support compliance outcomes. So, therefore, encouraging a culture of boundary respect strengthens patient safety, ethical performance, and regulatory adherence. So, this is not just a compliance strategy, and it's not just a wellness initiative, it's a necessity. Healthcare workers who lack clear physical and emotional boundaries face significantly higher burnout rates. A 2023 study during COVID found that providers who enforced work-life separation, like no checking work messages at home, were better protected from exhaustion and mistakes. And I don't know, most of us who are in the healthcare profession, we tend to be hard chargers. We do tend to be, I don't want to call us workaholics, but we're dedicated. We're passionate about what we do. And so in that, we have to learn to set boundaries. And one of the boundaries when I was actually working in a clinical setting that I found for myself was every day, when I wasn't on call, I would turn my phone off at 6 p.m. because I needed to be able to have that disconnect so that I could be refreshed and I wouldn't burn out when I went back the next day. So we need to not beat ourselves up for creating boundaries. We need to actually applaud ourselves. The NHS and other systems are now framing boundaries as compliance and wellness strategies. When organizations encourage these practices through policy or culture, they reduce burnout, improve engagement, and see fewer documentation errors. The psychosocial safety climate model supports boundaries through leadership and system wide changes, not just individual coping. Embedding these strategies into compliance training and workflow audits is a proven way to mitigate risk. So, boundaries as risk mitigation. Boundaries do what? They protect ethical decision making. They prevent compassion fatigue and overextension, and they promote professionalism and a safety culture. Compliance risk from burnout in the United States healthcare providers is amongst significantly high increases in compliance risk. A study from Stanford and JAMA showed that clinicians with burnout are twice as likely to commit medical errors. I mean, that's a no-brainer. If you're burnt out, you're obviously not going to be cognitively astute and functioning at your best. So what's going to happen? You're going to create medical errors. And this remains true even in organizations with otherwise strong safety cultures. A meta-analysis confirms that burnout undermines patient safety, resulting in higher adverse events and lower satisfaction ratings. Compliance is directly affected when documentation is incomplete, protocols are skipped, or teamwork breaks down. Burnout also erodes a error reporting culture. Providers under stress are likely to report incidents or near misses, which undermines transparency and compliance monitoring. Lastly, financial risk is real. Burnout is associated with higher malpractice claims. There's an estimated cost to the U.S. healthcare system of over $4.6 billion annually, highlighting a measurable compliance liability. And research across the U.S. healthcare system highlights several consistent organizational contributors to burnout and boundary erosion. So, for instance, workload intensity is a leading factor. Long shifts, high patient ratios, and unpredictable hours cause emotional depletion and blur work-life boundaries. Administrative burdens, especially from EHR documentation and regulatory compliance tasks, further displace time from direct patient care, increasing frustration. When providers lack autonomy and organizational support, their ability to maintain healthy boundaries weakens. Toxic cultures and blame environments discourage openness, reflection, and recovery. Additionally, clinicians facing effort reward imbalance. So you're doing all this work, you're not even getting the attaboy. No one's even giving you any type of recognition for all of the work that you're doing. Putting enormous efforts with little recognition can feel somewhat depleting and make you feel, not as valued. Reporting higher disengagement and emotional attachment is what sometimes happens when these clinicians, yourself, myself included, are experiencing this, devaluation. And finally, unclear career paths and limited professional growth can create stagnation. Whenever I worked in an environment in a managerial role, I wanted to make sure that I understood what career path or what my employees wanted to do in their profession. And I also tried to support them in that by encouraging them to take trainings that they wanted to take, not just the 102 trainings that we're required to take to meet our clinical mandates, but things that they thought that would help better them in their field, so that we could create growth and reduce stagnation, because stagnation leaves clinicians feeling trapped, undervalued, and exhausted. Several major regulatory bodies now explicitly link staff wellness to compliance and patient safety, reduce mortality, but also improve provider wellness and retention. Those organizations are CMS's Patient Over Paperwork Initiative, which supports clinicians by streamlining documentation demands, giving them more time for patient care, and reducing burnout. The OIG's 2023 General Compliance Program Guidance recognizes burnout as a compliance vulnerability, urging wellness integration into audits and education. In the state of California, they have what's called safe staffing legislation, which offers a case study. By setting patient to nurse ratios, it's not only reduced mortality, but it's also improved provider wellness and retention. These regulations affirm that investing in workforce well-being is not just good practice, it's compliance imperative. And what I mean by that, do they use any type of wellness metrics such as burnout surveys? Do they offer or encourage EAP usage or engagement scores? Are they increasingly recognizing things? What would it take to formally include wellness in your compliance dashboard? So, evaluating wellness strategies to reduce compliance risk through a compliance lens is both evidence-based and practical. A systematic review of resident wellness interventions has shown a significant reduction in burnout and increased job satisfaction, both strong predictors of lower compliance risk. Sleep and recovery programs have also been tied to reduced safety incidents, while process improvements like EHR optimization and team-based training have consistently shown a drop in errors. Stanford's landmark study demonstrated that burnout has the same predictive weight for errors as system-level safety issues. How many people are used to the Donna Biden model to evaluate your efforts, which consists of structure, process, and outcomes? Using these metrics show if your wellness strategy is making an impact on compliance performance. As you may know, or as you may be learning today, the Donna Biden model is a widely used framework for evaluating the quality of healthcare services. It was developed by Avita's Donna Biden in 1996, and the model organizes quality assessments into three interrelated components. Those components are structure, which is the physical and organizational infrastructure in which care is delivered; the process, the methods, procedures, and actions involved in giving and receiving care; and outcomes, the results of healthcare delivery and its impact on patient health and satisfaction. This model is especially valuable in compliance and quality monitoring because it encourages a systematic approach to evaluation performance. It supports root cause analysis by linking poor outcomes back to structural or process related deficiencies. It guides quality improvement initiatives across settings and roles, including documentation accuracy, coding compliance, and patient safety. When you're looking at embedding wellness into a compliance culture, the strategies must be proactive. Yale's resiliency rounds, which was a model, it's titled A Model for Retention and Transparency, boosted retention. Staff reported feeling heard and supported, reducing burnout and improving morale. When regular rounds were built into team cohesion, it showed that leadership was responsive. It enhanced transparency and created a safe space for honest dialogue, surfaced system issues, and strengthens trust between staff and leadership. This is directly connected to compliance because it supports psychological safety. It reduces risk of errors and aligns with quality and safety standards. Wellness champions in high-risk areas reduced OSHA citations by addressing burnout and safety concerns early. They promoted a culture of self-care, improved adherence to protocols, and provided real-time feedback to leadership, leading to fewer safety violations and better compliance. I want to give an example. I'm also a veteran, as you saw in my bio. And so I do get some of my care at the VA. And what I really respect about the VA is that they've instituted what's called the VA Whole Health Program, which is the Veterans Health Administration's transformative approach to healthcare that puts veterans, not the disease, at the center of care. And this has improved compliance and decreased work burnout because though they're doing this, they've also incorporated staff, and staff have to adapt to this model as well. So it includes burnout screenings and compliance audits because it will definitely it serves as early warning signs and systematic stressors. It identifies that. And it allows the leadership to take a targeted action like adjusting workloads and offering support before burnout leads to errors. So I want to give kudos to the VA for that, for doing that. It also includes burnout screenings and compliance audits, as I stated, because it identifies early warning signs and systemic stressors. It signals that staff wellness is part of risk management and quality care. And it's not just HR's responsibility when people are frustrated and filing grievances, it's everybody's responsibility. I want to point out that, in every work environment that I've worked, there has been what the social committee or the committee that, finds activities for staff to do. And I've always served on that. And I found it to be really rewarding. But it got me thinking, however, if we could have a social committee, why can't we create a wellness subcommittee to help embed staff support into organizational culture? You know, this would give employees a voice, promote accountability, and it could drive initiatives that address burnout, morale, and safety. And this would be a more proactive approach which can strengthen retention, compliance, and team engagement. It's low hanging fruit, really. I mean, if you think about it, it's an opportunity for you and your organization to adopt and to help combat burnout, which can lead to compliance risk. And you don't really have to do a lot. I want to give a shout out to my most recent organization I worked at. The Office of the State Inspector General in Virginia. And one of the things that I thought was really cool that their social committee did, and it wasn't formally called a wellness subcommittee, but one thing that they did is that they would have activities to include wellness, where you would have staff walks every day at 12 noon. They would come around and gather up the troops, and you would walk and you would talk and you would share things that were going on. And these were from different divisions. Everyone would come together. And I just think if they maybe formalize that, and had it so it could be a wellness component where you could feel, safe and transparent in sharing some of your concerns, and that they would get back to leadership, then maybe make some changes that would be good. But again, that costs nothing. It was free, and it was just colleagues coming together, walking and really caring about each other's well-being. So embedding wellness into compliance is really, really important, to be able to do that within the existing structures that you already have in place. It doesn't have to be more work. These steps are about alignment, not addition. By building wellness into structures already in place, for instance, audit tools that are already in place, compliance meetings, your annual meetings that you have, your annual trainings where you can reinforce that staff care is part of risk management. For example, a 5 minutes wellness watch during a compliance meeting can suffice. It can surface important concerns. Having QR coded polls like we're doing today, or rounding questions to help identify fatigue trends without requiring a full scale survey. And doing things anonymously can also help, tackle those areas so people don't feel so vulnerable, but do feel open enough to share. Training staff to recognize burnout and manage boundaries improves both safety and documentation quality. Training, training, training. But not training in a way where we're just training just to say we're training, ensuring that we're hearing from colleagues and what they're finding to be some of the things that are exhaustive and leading to burnout. Designating unit level wellness champions to create a clear feedback loop and using existing data. I saw someone say that they do use data from most of their from that they receive, but like PTO or sick days, what are the trends around that? This lets compliance teams monitor workforce health without an added burden. And finally, by normalizing burnout discussions and leadership culture, organizations build psychological safety and it strengthens overall compliance in the end. Let's be clear. Organizations that fail to recognize and address burnout, compassion fatigue, and moral distress face steep costs. Turnover is one of the most measurable expenses. Replacing a single physician can cost an organization up to $1 million. Nurse turnover also adds up quickly as well, especially on high risk units. But beyond financials, compliance risk rise sharply. Burnout is linked to a doubling of medical errors and underreporting. Documentation quality and safety adherence decline when staff are emotionally or ethically overwhelmed. Patient satisfaction, which is supposed to be our most important, thing that we're concerned about, also suffers. Disengaged clinicians affect service quality, lowering survey scores and impacting reimbursement. Unaddressed distress also fuels malpractice claims, and the reputation is damaged of the organization. Investing in wellness isn't a perk. It's a measurable risk mitigation strategy with return on investment across compliance, safety, and financial health. You may be asking yourself, well, what can I do in the next 30 days? You can review one policy to reflect wellness goals, host a team check in or wellness roundtable, ask compliance to include wellness in its annual training, share today's insights with your leadership team. Yes, you, regardless of your role in the organization, no matter what that is, you are able to effect change. I would like to challenge you to think about one concrete step you can take within the next 30 days. It's intentionally broad to meet you where you are, whether that's a small personal shift or a larger systemic change. After today's session, what actions are you most committed to pursuing? Use this as a moment of commitment and momentum. What's the one thing you can do this week to jumpstart, what your commitment is, and think about who can support you in this commitment. the majority stated that they're going to commit to one weekly action that supports their own well-being. And again, I can't stress enough how important that is. You, the caregiver, have to make sure that you're seeking appropriate care. The next runner up was set or reinforce a personal professional boundary. Yes, I always encourage that. And start a wellness conversation in my compliance or leadership team. Absolutely. Every little bit helps. And sometimes our, leaders don't recognize that this needs to be incorporated. They're looking at the big picture. So these are all great, and I'm encouraging you to do so. This concludes our training today, and I appreciate all of your participation and your enthusiasm and your interaction with me. Have a great afternoon, everyone.